Hi, everyone, and welcome back to the Anxiety Chicks podcast. I'm Allison Sepanera,
And I'm Taylor.
and we are so excited today because we have a guest that I've wanted to come on for so long and was supposed to be on the show, I think last week or the week before, but things happen in life, and we're so glad everything's okay. And you're here this week. And I'm so excited. Dr. Eileen Li is here. Hello. Nice to see
Hi,
you.
everyone. I'm so excited to be here.
Yay. So I am so excited, you guys, because of course we're almost at our 200th episode. I don't know if this is it.
This is 200.
Oh my gosh,
I know.
stop.
Ooh, what an
Yeah,
What
I
honor.
saw that.
what an
No pressure.
amazing 200th episode. I'm not even kidding. I feel like this was meant to happen for you to come on this episode because out of so much of what we've talked about up until now on this podcast over the last couple of years, this topic is so near and dear to my heart, and so near and dear to kind of the mission of what I want to do and how I want to educate people in my channel, but also my groups and my practice, private practice, and just all things holistic that I want to learn about. And so I'm going to tell everyone a little bit more about Dr. Li before we get started, but I'm so excited that we're going to talk all about acupuncture and what that is. Some people kind of don't even really understand it. A little bit more about Chinese medicine and plant medicine and herbalism and all of that good stuff that really I feel like helps us get to the root cause of a lot of physical and emotional and mental pain. So without further ado, this is Dr. Eileen Li, and she is a licensed acupuncturist, Chinese medicine herbalist, and physical therapist with over a decade of clinical experience. Growing up with an acupuncturist mother, they were immersed in Chinese medicine early on, leading them to blend Eastern and Western approaches to health. With a background in chronic pain research and a doctorate in physical therapy, Dr. Li is passionate about helping others achieve optimal well being. So thank you so much for being here, Dr. Li.
Thank you so much for inviting me. Eileen, please.
Eileen, okay, sorry. I
No
like
worries.
Dr. Li.
It's so
Um,
official.
so I'd love for you to start by telling us a little bit more about you. And it sounds like you've had sort of this Chinese medicine herbalism type of history with your family and stuff. And I just love to hear a little bit more about what got you here today.
Yeah, definitely. It started when I was a kid. My mom was an acupuncturist student. Oh my gosh, what was this? In the 90s. And she was going to school. I remember commuting on the train with her. And at that time, I think I was in elementary school. And I would go to these classes with her, not really understanding what was going on, but knowing that it was a big part of my upbringing. So everything she learned in school, I grew up with drinking hot water, drinking herbs, which tasted a lot like dirt, but I thoroughly enjoyed it because it did help, and receiving treatments with her. As I grew up into a young woman, I went off to college. I was wicked stubborn. I was like, I'm going to study physical therapy. That's what I want to do. I want to be in sports. I want to be physically active. I want to help people. Um, and my mom always said to me, Eileen, one day you're going to come back to Chinese medicine. And I don't know when, I don't know how, but you're going to come back because this is a part of your culture and who you are as a person. And I didn't really understand that, but I think she primed my brain from a very young age. But, anyways, I graduated as a physical therapist. I practiced for about 5, 6 years, and then I ceilinged and realized that I was out of tools in my toolbox to truly help people. And I did everything that I wanted to do, treating from, women who were pregnant to seeing babies in the NICU to my oldest patient who was like 103. Um, and then right around where I ceilinged out and reached like this level of director position in the physical therapy rehab world, I realized that it was time to change a different direction in my career. And that's when I resigned and I signed up for Chinese medicine school. And even when I arrived, I still didn't know if I was fully committed to the bit. And towards the end of Chinese medicine school, I realized, oh, wow, there is so much that this medicine has to offer me that I didn't understand at a very young age. But I was flooded with memories, this nostalgia, like when I was experiencing the medicine or being a part of, other people's healing process. That so much of my upbringing does revolve around, Chinese medicine, culture, and health. So that's where I am today. I run a clinic, full-time clinician, just me, front desk, tea tender, housekeeping even. And also I do social media, whenever I can, but now I'm a new mom. But I run a full-time clinic here in Old Greenwich, Connecticut, and I see to this day kids, athletes, moms, postpartum, everything you can name under the sun. And one of my specialties is anxiety and chronic pain.
Wow.
Well, right?
Wow.
That is my true story.
Immediately, I don't know about you, Allison, but like my brain just got filled with like 57,000 questions that I don't want to get anything out of order. So you guys let me know when I can throw in a question.
No worries.
No, I'd be in a please, Taylor.
My brain, okay. Immediately, my brain just went to, okay, you're a new mom. There's so much, I feel like, new evidence, studies, things being done on women and pregnancy and da 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 da. How different is taking a Chinese medicine and acupuncture route compared to just Western medicine?
Oh, for me, it was like home, honestly. Like I don't know anything other than even like just going through my pregnancy, getting pregnant, going through my pregnancy, and then postpartum. I really exercised one, the culture of this concept in Chinese medicine called 坐月子, which is basically a sitting period where a woman doesn't do anything and she's taken care of, and she has her village to take care of her so that she could heal. Now, for me, I had a C-section, so my sitting period really extended out to 2 months. Um, and for me, like that was, I believe, a big part of my healing postpartum. And yeah, so I guess I don't really think too much about like what is going on in the Western medicine world or whatnot, because I don't think that's really something that's deeply talked about as much as it is in like at least in Asian cultures.
Yeah.
Hmm.
That is so interesting. I also am so curious about the connection with physical therapy and just the holistic model and like the Eastern medicine model, and where physical therapy kind of fits in with all of that.
Yeah, like when I was a physical therapist, it's a very one active job, getting people to move. But having been a physical therapist, I saw a few limitations, and one of the biggest limitations wasn't that people weren't motivated to move, but that their brain had a really hard time bypassing a certain framework or a mindset of like, this hurts too much, so I can't move, or this is about it. Like, this is all I can do. And the really amazing thing is now that I practice acupuncture and like chronic pain is my specialty, I basically help a lot of patients be able to move through the pain or rewire their brain into rethinking how pain is expressed in their body. So, one, by like raising the threshold in their body so that when they have like a painful experience or a pain event, it's not nearly as bad, or it's not the same sensation, or it doesn't last as long. And for me, that's a real gift because I immediately build trust with my patients that it works and it's super effective. Now, with physical therapy, on the other hand, it's also really beautiful and it works. But what I did find was that it took a lot longer. And when things take a lot longer, people also lose motivation to kind of buy into it as well. So, compliance kind of goes a little bit up and down. But I've noticed that since I opened up my clinic, practicing Chinese medicine as, the only practitioner and seeing my patients make these like great strides, I knew there and then that like this medicine was something. This was bigger than what I did as a former physical therapist.
That's crazy what you said about the limitations a lot of patients feel when they go to physical therapy. So, a personal experience, my mom actually 3 months ago ruptured her Achilles
Hmm.
and she's in physical therapy. And I think that just that brain connection to the injury has been the biggest. Like, I don't even think the surgery, the healing, all of that is anything compared to her with this leg that she says feels foreign to her body now.
Mm,
And that gap between, will this ever be my leg again,
right.
and pushing through that, like that seems like the hardest part she's been through, which is crazy because it's like she's not really in, I mean, she's not in pain, but she's in like, it's so tight and the physical therapy is so, they're pushing you so hard,
Right.
and emotionally connecting to that has been so hard. Like she's always crying.
Yeah.
It's very, there's so much of the brain and the body connection, I feel like, in physical therapy in general, because it is, you're literally taking something that, say you had a surgery, they literally fixed it up and it doesn't feel like your body anymore.
Oh, you made a really great point. I mean, like when I was a PT and now like acupuncturist, what I've really seen when I was a physical therapist is, especially after something like a surgery, it's this fear of like wanting to move your body.
Mm.
Will I re-injure it? Will this happen
Yep,
again?
yep.
Do I have to get surgery again? Because I've seen patients who had to get revisions and, and sometimes like their surgeries come out great and fine, but like I've also seen people who failed from surgery. And when I worked in chronic pain research, this is like when I was a physical therapist at Boston Children's, I saw a lot of kids who were afraid to move. And then I had to teach parents like how to encourage kids to move and give them coping strategies in the face of pain. So like that's a really big aspect of like what I did as a physical therapist. It's not like your traditional like, oh, here's like 3 sets, do 3 sets of 10 and whatever. And like, there's a lot of like clinics, physical therapy clinics that are kind of like that, where you don't really have to use a lot of brain power um, to help someone get through it because movement, any movement is better than no movement. But what I see a lot of like people get left with, like someone like your mom, is that there's a literal dysfunction in potentially like the way her nerves are firing and the way her brain is perceiving
Mm-hmm.
that pain. So acupuncture has been magical. I don't even want to say it's magical, it's just been effective for a lot of people because they suddenly get this hard boot, like a software update, that no, they're
Mm.
okay. Tissue has healed according to timeline. And for some reason, chronic pain arises because there is this chronic dysfunction in the brain that like can't reset for some reason. So Chinese medicine is really beautiful in that like when people get acupuncture, the results are almost instant.
That's how
Wow.
that's actually for me specifically. I've done acupuncture for years,
Hmm.
and I like I would say a year ago or maybe 2 years ago is when my dad died because I automatically, literally right after he died, had horrible lower back pain, which I've read about now and knowing that there's a lot of stored trauma in the lower back.
Hmm.
I'm still struggling with my back. I think it's not just that because I do
You
have
can
like
you
a
can come see
disc
me.
there. Yeah, totally. I know. Since I'm gonna be there in a couple of weeks, so we're gonna have to
Yes.
get together. Um, but I also had like really bad TMJ, like I was grinding my teeth. I was just in pain. I was going through grief. I wasn't sleeping, all this stuff.
I
And
remember that. You were super symptomatic.
it was horrible.
I remember that.
I ended up actually getting shingles, believe
Mm-hmm.
it or not,
Oh.
which was
Mm.
horrific. Didn't even know what was going on. Like who gets shingles in their 40s. So thank God I'm okay, but I remember thinking in those couple weeks or months that was happening, the only time I would actually feel better is right after my acupuncture sessions. And my
Mm.
acupuncturist is so amazing. It's like going to therapy, but times two, because she sits there with me and asks me about certain things. And then she puts me on the table and sometimes she gives me an extra 5-10 minutes. And I literally felt right after I got in my car, I had no back pain. I had no, I also was having really bad headaches. And I just thought to myself, what is going on? What in the sorcery
Mm.
is this? I was just I totally believed in it. I don't even know enough about it, which is why I also was so excited to have you on to learn more about it. So I'd love for you to kind of just explain a little bit about acupuncture for the listeners and the people watching. Like just kind of go back to the very basics. Like, what
Yeah.
is it? you know?
That's what I excel at, going back at the very basics. I don't
Yeah.
use a lot of like TCM terminology fluff. Like a lot of people hear the word tea and they think that it's this mystical like energy force, but actually Chinese medicine, if I were, let me take a step back before I explain the process. It's a very tangible medicine. Like we all have a vessel, a body, and within our vessel, like we have organs and nerves and arteries, right? The Chinese were some of the first to discover this anatomy and physiology, and they discovered it. You know, I don't really, I'm not a great history buff or anything, but way before the West did. So, that's how acupuncture points came to be. And then, the language that they use even in Chinese medicine has a lot of parallels to Western medicine, but it's just not said as like spinal nerves, peripheral nerves, the central nervous system. They just have like their own vocabulary. But to explain acupuncture in the meats and potatoes, it's that it helps regulate the nervous system and improve circulation. So, some of the biggest foundations in Chinese medicine and health, and because health is a culture over there, is having proper blood flow. And so, when we're anxious, you know, or anything like that, or have chronic pain, it's usually an imbalance of some of the major channels. If you can imagine these lines, which are not invisible, by the way, but lines running down in your body, kind of like subway channels that, when you have chronic pain, there's a station in the subway stop that hurts, and when you have anxiety, there's certain organs within the Chinese medicine framework that experience an imbalance, like either whether it's like a deficiency or a stagnation or some kind of like heaty symptoms. We use the word heat, and that's just a fancy word for inflammation. So it's interesting that you explain the story of like, acupuncture. In some ways it's a little better than therapy in a way, because in my culture, especially Asian culture, Chinese culture, we don't really express ourselves in terms of feelings, and it's more somatic. So like my parents would be like, "Oh, I have like a lot of high blood pressure or my back hurts," instead of, "Oh, I have depression," or like I'm upset with somebody. And what's really cool is like my patients come here and they don't really have to say much, but like their tongue, their pulse, those are our diagnostic tools, will tell me a lot about what's going on. And they usually just point where it hurts. And I already have a good idea of like what channels are affected on their body. So they just lay there and I just do my thing as their practitioner. But the way the treatment works is that these fine little needles go into very specific points on the body, these acupuncture points, where it's concentrated with nerve endings and blood vessels. And it's so rich that when you put a pin in, it sends a signal right away up to the brain and says, "We need more of dopamine, we need more serotonin, we need more endorphins in these locations of the body." And this is particularly true also like when someone's experiencing like back pain or knee pain, we might not even needle where it hurts, which is really cool to be able to talk to your brain, which is like the central computing system that delivers a message to the rest of the body of like what you need, because your body is already its own pharmacy, and acupuncture is just accessing that pharmacy to help you release whatever it is to that you have ailments or pain towards.
Oh my gosh. Um I was just thinking, as you were saying this, my acupuncturist, like I can imagine if you lived near me, I would want to come see you because you have such a like calming I know you're through my computer right now, but you still have this like calming presence and and a way to explain it that makes it feel comforting because and I think that's really important, especially when you struggle with anxiety, because there's a lot of people
Oh
that
yeah.
are
Hmm.
not a fan of one, needles, right?
Yeah, they become big
Um,
fans if they find the right practitioner. They become
to-
really big fans. Yeah.
totally. Yes. And
Hmm.
I've never been someone, I don't know. Taylor, have you ever tried acupuncture?
So I actually have a funny story. So someone told me
Okay.
once this, and you know how it's really hard when you have anxiety to like forget things you've heard.
Yeah.
Someone told
Yeah.
me one time they were like, "Yeah, acupuncture is so amazing. However, there's like this period where when you get acupuncture, you might feel like a little dizzy." So I feel like I've always been like, so I wanted to ask you on that, like, why can that happen, and is it true, and like, how long does it last? Like, why would that? They said it's like a release in the body that
Yeah.
can.
I mean, dizziness is not an uncommon thing. I wouldn't say like, I would say it happens like in a handful of people amongst like a really big population of people getting acupuncture. Some people have like a more sensitive vagus nerve
Yeah.
or like they didn't like hydrate or eat well before the session. So, and then like,
Do you feel like it's more of the phobia coming into play of
yeah, and
needles?
that was my other thing I was
Okay.
going to mention. Some people hype themselves up like this is going to be
Yeah.
terrible. Like I'm going to feel these needles and oh my gosh, like I can't believe there's so many needles in me. It's I feel like if you find the right practitioner, they can gauge your body. Um, like for my patients, like feeling pulse, looking at tongue, looking at the strength of their overall constitution, like their profile will tell me a little bit about how strong that they can, receive the treatment. Whether it's like, like if I know somebody who has like a lot of anxiety, I'm probably not going to throw like more than 10 needles in them you know
Mm.
I just like to gauge. I always tell my patients like we're dating a little bit, so I want to see if we're a good match. One, I want to get your result, but like two, I want to make sure that we're a good match and that you feel comfortable. And Allison, it's so great that you mentioned like the communication aspect, because I feel like it's not just like Chinese medicine practitioners like not being able to explain things in a layman's terms to patients who have no like medical background or healthcare background. It's all practitioners, right? Like in whatever industry, like being able to just explain it like you're five, that
Hmm.
this is how it works, which I think settles a lot of people with anxiety. And then at the end of treatments, like being able to give like my patient parameters, like what to look for, treat this as a rest day,
Mm.
what's improved, what's not improved, come talk to me next time. So,
Yeah.
Wow, that actually makes a lot of sense. I've had dry needling a lot.
mhm.
What's the difference between a dry needling and an acupuncture needle?
For me, I mean, when I was a physical therapist, I practiced dry needling. Dry needling is usually just localized to like a specific body part that the physical therapist is treating in
Hmm.
conjunction with what you're doing in rehab, whether it's like, oh, I have shoulder pain, and they just usually needle around the shoulder.
Hmm.
Um, it's still an acupuncture needle.
Hmm.
Their main focus now, first, before I continue, I know the evolution of dry needling techniques has evolved since I've been a PT, but traditionally, from what I remember, is they would needle locally where it hurts or where it's stiff in order to improve range of motion, improve blood flow, improve strength. So sometimes, I don't know, Taylor, like when you got dry needling, were there a lot of like muscle twitches? Because that's a response a lot of physical therapists would look for. But I do know that a lot of acupuncturists also practice a similar technique, and it's called trigger point therapy, trigger
Mm.
point release. Um, they just don't call it dry needling, but the two are very parallel. It's a similar style, different, medical terminology, different terms. But if you find that like an acupuncturist that practices that kind of style because you responded so well to dry needling, you get a lot of bang for your buck. Now, there's also a lot of people who don't respond to dry needling, and then suddenly they have this um they create this correlation thinking like, well, like I got needled before and like I'm too scared to try acupuncture now. And what I will say to people is, well, if dry needling didn't work out for you, it doesn't mean that acupuncture won't work at all, because it's just one style of acupuncture. There's like 1,000 ways to bake a cake. There's so many different styles of the way we needle. There's Korean acupuncture, Japanese acupuncture, there's Chinese style acupuncture. So I always say take things with a little a bit of a grain of salt in how, you get needled, but I also believe if it works, it works.
Yeah, no. So when I've had dry needling, I've felt like an electrocute like feeling sometimes if they hit like the right spot.
Right.
It's worked wonders for me on like just like my legs, like the way I can exercise, say 2 to 3 days after. It's like I'm 5 years old again. I don't know how to
Yeah,
explain
yeah.
that, but it's literally like I could go run a marathon untrained. It's a very interesting feeling. But what's interesting is the day I get it done,
Hmm.
and I didn't know that that's an acupuncture needle. That needle's like nothing.
Hmm. Yeah,
You
exactly.
barely,
It's like
yeah.
nothing. You're not getting a flu shot,
No,
right?
no, no, no. And so, well, what I will say, so acupuncture needles are left in, right?
Yeah, so traditionally, well, I know that some dry needling courses now have needle retention, and they started like kind of daddling into the scope of like electrical stimulation, clipping
Yeah, I've looked into
wires
that.
to it
Absolutely
to
not.
make, yeah, to make the muscles move. So there's a lot of gray area between that. But in my opinion, I'm biased. I think lots of acupuncturists know the concept of dry needling. They just have a different style name to it.
Hmm. What's funny is every time I get dry needling, the literally that night, I'm so exhausted.
Yeah, that
Is
makes
that so? Is
sense.
that a normal
Yeah,
like
it's
sensation
normal.
after acupuncture too? Just like
It,
the body's doing a lot of work and recovery, right? See, I
mm-hmm.
reminded myself that I'm like, it's stimulating my nerves and like my muscles.
Right.
So it's almost like you're doing a workout, but you didn't.
Yeah. Yeah. I mean, that's why I treat like dry needling or trigger point release, whatever you want to call it, or like the first couple sessions, I tell patients, I'm like, you might feel kind of like sluggish, a little bit
Yeah.
run down,
Yeah. I was
and
like,
that's
am I getting the
completely normal.
flu?
Yeah, yeah. I was just
Like,
gonna say you might feel like you're getting the flu, but I just want
yeah.
to let you know within like 12 to 48 hours, that's gonna be all gone.
Yeah. What is
Yeah.
that? Is that just like the brain muscle connection just working really hard?
Some of it is the brain muscle connection. So like when you get dry needling, a lot of the times it's working on the fascia and like stimulating the nerves and the muscle bundles. But what's also happening on a bigger picture is that there's like this inflammation response
Mm.
because you need inflammation in order to heal. So
Huh.
what happens is like I'm not sure why you got dry needling, but I do know a lot of like my chronic pain patients. They're constantly in this low grade inflammation. Like there's nothing truly wrong with their body in terms of not that like tight tissues isn't something wrong, but like their tissues healed according to timeline, but their body, like their mind is constantly like in this low grade fear, like anxiety provoking cycle that's triggering like this low grade inflammation in their body. So when you come in with something like dry needling, but more importantly, acupuncture, you're resetting that system. So
Yeah.
it's funny, a lot of my chronic pain patients don't actually respond well to dry needling. They actually respond to much more gentle acupuncture techniques, like away from the site of pain.
Hmm.
Because for at least for me, the way I like to work on things is reset their brain,
Yeah.
literally help them rewire their perception of pain before I go in and really start digging into some tissues to let the tissues heal, in a better structure or get more blood flow.
Wow.
That's so interesting. I have never done dry needling, and honestly, I've heard about it. And so, wait, so really quick, just for my curiosity, dry needling just pinpoints a specific part of your body, and then the needles don't stay in there?
Technically, but I do
Okay.
know that there's some courses nowadays are kind of retaining needles and they're doing electrical stimulation to the
I've seen
needles,
that.
which yeah,
It
you
does not look like something like that people would just volunteer and do. Like it literally looks insane. Like you have, I think if you agree to that treatment, you should be checked in a little bit, like, ooh. Like they literally attach like a TENS machine to the needles.
yeah. I mean, I do it in my clinic, and
Oh,
with highly anxious people and they're fine.
ah, no.
I mean, I don't even know what you're talking about, but I would totally be interested in
Look it
looking
up.
at it
Look it up.
for sure.
Yeah.
I mean, no, like I feel like I'd try like anything when it comes to kind of like
you'll see a lot of
Eastern
you'll see a lot of
medicine.
physical therapists, chiropractors like practice dry needling. And the thing with that is like they're trying to achieve like muscle dysfunction restoration. But when you're trying to differentiate between dry needling and TCM, there with a treatment like dry needling, it's not looking necessarily at the whole body,
Yeah.
which I feel lacks a little bit. So I actually have like a lot of physical therapists send me over their patients where like they may have received dry
Mm.
needling once or twice, but then they're like, no, Eileen can like clean the rest up. Like she can, do the rest or whatever needs to get done. Um, so it's like it's dry needling can be potentially a good introduction to a style of acupuncture if you enjoy it and you find the right practitioner that practice a style similar to it.
Well, I
Okay,
enjoy dry needling, honestly. So that's actually very helpful to hear. That makes me feel like I'm one step closer to
There
acupuncture.
you go. Yeah, yeah, yeah. But more often than not, like I have people who are scared of like needles, and I actually end up just like doing a couple points on their shins to treat like their digestive issues or their hands and feet to treat back pain. And they're like, "Wait, what about my back?" And I'm like, "Well, stand up, move around, see how it feels." And they're like, "It's gone." And I'm like, "I know, it's crazy, right?"
And then they're like, more, more, more,
More,
more.
more, more. Yeah,
Yeah,
this is
more
what I
needles.
mean. This is how it starts, Taylor. Like they're
Yeah.
like, wait, but what about here? What about there? What else can you do?
Yeah.
So dry
You just
needling,
got to give
I
them a little taste.
exactly, exactly. So I feel like dry needling, a lot of people associated with acupuncture. And to that I say, I totally understand why the public misunderstands that. And suddenly, if they had a terrible experience with dry needling or like it created this fear around like the needle from that
Mm.
kind of treatment, I can see why like they wouldn't want to like try acupuncture. But I just want everyone to know there's so many different styles. I think it's really important to ask a practitioner what type of style they do.
That's going to be my next question for anyone watching or listening. Where do you think that someone would start? Or like where do you think someone should start if they are listening or watching this and thinking, okay, this actually sounds it's something I've heard of, right? Because I have so many people that I even work with in my practice who get just anxious thinking about acupuncture. And it may not be
Hmm.
because of like the needle. They're probably like, it's just thinking of not knowing enough about it. Right.
Ooh,
So
yeah.
what would you say?
I would actually start off with acupressure, which are no needles. You can still press the acupuncture slash acupressure points. They're the same points. It's non-insertive. You can get a little gua sha tool. You can use the end of a Sharpie. You can use your fingers. You can use your knuckle. And if you press on these specific points, you will find out if it works or it doesn't work. Now, if it works and you find relief, chances are you are probably going to respond very well to acupuncture, and it's probably a great medicine to dive into. And people might ask, well, where do I find like acupuncture points or sorry, acupressure points? Um, well, I know like I have that on my social media, but there's tons
Yes.
of creators who, post these types of like healthy tips and tricks on, 2 points for back pain, 1 point for constipation. So, things of that sort. I've actually recently last year, well, during my postpartum, I like created this acupressure guide, which I'll send you the link so you can take a look at
Yes.
it.
I'll
And
put
if
it in the show
anyone,
notes.
yeah, yeah,
Yeah.
yeah, I'll put it if you don't mind. But this
Yeah.
acupressure guide, basically going step by step on the top five most common, points that I use, like that are super effective for, everyday issues, and kind of explaining like what's acupressure and whatnot. How should you be feeling? How often do you need to do it? Because this could be as self-guided as you'd like it to be, or if you want to take the thinking out of it, see a practitioner.
I love that. Yes, we will definitely put that in the show notes. I think that's such a huge, um, probably a huge relief for a lot of people to think like, okay, wow, I want to try this maybe before going and diving
Oh
deep into
yeah,
the
absolutely.
acupuncture.
You got to be sold in something a little bit to be
Yeah.
like, well, yeah, this might work for me.
Yeah. Quickly say the name of your Instagram handle.
Sure. My Instagram handle is anew.acu,
Perfect. And we'll have it in the show notes too. But before also, can you when I was doing some research on acupressure too, can you show us like where on, because we're obviously we can see above, the
Yeah,
chest or whatever, but
sure.
there are so many points around our face and ears and stuff, right? That actually are really helpful for like stress relief,
Oh
right?
yeah, yeah. I think my favorite, you want me to show you one?
Yeah, yeah.
I
I'd
think
love
my
to see
favorite
it.
one is Li4. So that would be the web space between the second and the thumb. And it's this
Okay.
big meaty part right here that if you bring your fingers together like this, the thumb and the index finger, this
Mhm.
muscle should pop out, right?
Oh,
So
yeah.
at the peak of that muscle, you're going to press with your opposite thumb in towards the side of the second finger bone, and it should feel achy. And
Am
that's
I
what I
doing
try
that
to,
right?
yeah. So, like, you want to take your thumb or whatever you've got and find the meatiest part between the second and thumb finger here, and you press in towards the second finger's bone, the index finger bone, and it should feel achy.
Oh,
So that point, Li4, is I call a big bowel mover, but also helps relieve headaches and it also helps your body release endorphins. Every acupuncture point has multiple functions and effects. So that's why I think acupuncture is so cool, is because there's so much bang for your buck with one point. But I really love that one, especially for my patients who have migraines, any kind of headaches, any kind of stress, any kind of like holding things in, pressing that point, hold it for, like 15 to 30 seconds, release, do a couple rounds, take a couple deep breaths, see if the migraine or the headache goes away, see if it lessens a bit, see if your stress goes away a little bit. Might stimulate your intestines, see if you have to go to the bathroom, things like that.
that is
I that's oh sorry.
go no, that I was just going to say really quick. That's so funny that you say that. I don't do exactly that when I'm like
Mhm.
sometimes when I'm in the doctor's office, I actually sometimes when I'm really like I know I'm going to get like a needle or something where
Yeah.
I'm not scared, I just know it's a little bit of pain or
Yeah.
discomfort. I literally
Yeah.
squeeze this
Yeah. Yeah.
and for
Yeah.
some reason it like makes me feel
It makes you feel
so
a little calmer.
yeah, I
Yeah.
like just squeeze the center of this and I just
Yep.
squeeze it and it makes
Hmm.
me for which I actually just thought I did on my own because I was
Yeah.
like,
Would that be the same thing?
Yeah. I mean, LA4, there's some room where the point is. There's like the anatomical instructions on how to get there. But in my opinion, is as long as you feel the ache in that region, you're pretty much on it. But
Wow.
so
what
crazy.
acupuncturists look for is like the most intense, region of where you're going to feel the ache. So I'm a little bit more precise, but for like my followers or for my patients, as long as they feel it, that's the most important thing.
Wow. It's crazy how like you say, "Oh, if they do this, it can help this, this, and this." I literally have a friend and if something happens to him, like he catches the flu, right? He's like,
Right.
I just need to go to acupuncture. I'm like, what are you doing at this place? Like, I remember asking them that. I'm like, what? Every time you have some sort of ailment, you literally tell me you just need to go to acupuncture. I'm like, that sounds like too good to be true, but like it. When you really talk to people who are avid acupuncture goers and they go to someone they really love, they can't speak enough about it. That's what's so interesting to me about acupuncture is when you talk to someone who's been there, been relieved of whatever, they don't shut up about it. They're like affiliate links of life, It's crazy.
I love that. Affiliate links of life.
I
It's so
yeah, I
funny.
actually had a friend that years ago debilitating migraines. Like used to have to leave work for days, be in a dark room, would be throwing up. I mean, really debilitating and off and on for years. So tried to get different treatments. And I think at one point a lot of different doctors put her on different antidepressants.
Hmm.
And I think she said that kind of helped sometimes, but then they came back and then she went to acupuncture and literally hasn't had migraines since she went to acupuncture.
That's
Said it
awesome.
like
Did
saved her life.
did
Yeah.
she end up staying on antidepressants or?
No, she went off of them, but then went on back on them for different reasons. Not
Mm,
for the
no worries.
migraines. Hey, come on,
The stresses of life,
been there.
understood.
We've all been
Yeah.
there. But
Uh-huh.
yeah, I mean, crazy.
Yeah, it's funny you said that because I it just reminded me of a couple of my patients who come to me with like anxiety and whatnot, and a lot of them are like on antidepressants or whatnot, and sometimes I take them down the path of like Chinese herbal medicine while they're doing acupuncture. So like, oh, one thing I forgot to mention about acupuncture, other than like improving like nervous system regulation and blood flow, is that a lot of people who take medications, that includes like antidepressants or like, heart medications, they actually go back to their doctors for like annual checkups and find that they don't have to increase the dosage because by improving your blood circulation, your body is more equipped to absorb medication more readily. So that's one really cool thing that I've noticed, is that they didn't have to go up on medication. And then for people who like have to stay on medication or are trying to like wean themselves off, a lot of acupuncturists also practice Chinese herbal medicine. And in those that do practice Chinese herbal medicine, they'll often do both Western and Eastern. So the Eastern portion of Chinese herbal medicine is going to be very supportive of what's happening with Western, because no matter what, there are some side effects to it, right? And then a lot of my patients who are anxious and are on anti-anxiety meds have a little bit of anxiety of like, am I going to be dependent on this forever? So sometimes we set goals of like, okay, if your goal is to eventually get off because you're just going through this phase in your life, what does that look like? Because one, I'm not your psychiatrist, so I'm not going to take you off of it. You have to go back to them and say, like, you're ready to, like, taper off a bit. Herbal medicine will be here to help nourish your body and give you that kind of support before the goal is, anti-anxiety meds as needed. So that's been really cool. It's something I've noticed in my 4 or 5 years since my practice opening.
Which actually brings me to one of the questions that we got some questions from people um, that I actually got this question from more than one person about if any kind of like herbal medicines interact with pharmaceutical medications or like prescriptions. And is there any reason why anything would interact in a negative way? Or I don't know how much you can speak on that, but
Yeah, I'll speak in like general terms. I think that no matter what you take, there's always an opportunity, like a risk for interactions, right? Like supplements could interact, with whatever you're taking Western medicine wise. Like one herb that comes to mind is St. John's wort. So it's not a TCM herb, but like that can interfere with like antidepressants. But those who have been trained in like Chinese herbology already know and have a list of like contraindicated herbs that may have interaction with Western medicine, or caution herbs. Like, it's not off the list, but just proceed with caution. I would say a lot of the I don't want to call them like anti-anxiety herbal formulas, because we don't treat necessarily by symptom, we treat by people's patterns. That's the way we diagnose, is that you're just a pattern, like a set of symptoms. Um there doesn't tend to be a lot of interactions between what's happening with like antidepressants or anti-anxiety meds. So, generally pretty safe.
good. Okay, good. And as far as like, I know you mentioned that one herb, but is there any kind of like, if you could say like the top types of medicines that are natural herbal medicines for stress and anxiety?
Oh yeah.
What would you like? What are some that roll off your tongue like that you'd
Oh, the
say
first one,
would?
the first one I think majority of people need, especially in the anxiety world, is this formula called 加味小药散. And there's an English name to it. Don't
Come
worry.
again. Okay.
It's
No,
called
right.
free. It's called Free and Easy Wanderer. That's the nickname for it. Um, it's really awesome. Two major herbs that are in it are white peony root. It's known as baishao, and that acts. It's made from it's a plant root, but it has compounds that mimics estrogen. They call them phytoestrogens. So it helps keep your hormones in check. And what I find in a lot of people with like high anxiety is that they're often anxious, and especially in women. Let's talk about women. And usually it's due to some kind of life event that's happening, whether it's like puberty, whether it's pregnancy, whether it's postpartum, whether there's perimenopause, then it's menopause. There's always like this hormonal imbalance component that needs to be addressed. And acupuncture is really wonderful at that. But when you marry it with herbs, there's a longer term systemic effect to help someone get through that stage. So that's one formula that I think of for almost all the women that come through here. And also because like we live in a very modern, stressed out world, we need something that's going to kind of combat like how we feel. And a lot of people don't want to feel dependent on Western, medicine. So feeling like they could depend on, like something more natural, like a Chinese herbal formula, it you take the herb and it builds, and you take it intensely for a period of time for the healing effect until you naturally just keep taking it and tapering down for just more of the benefit effect, meaning like your body doesn't need as much because herbs help you heal. Acupuncture helps you heal because your body has become stronger.
That reminds me, I need to book an acupuncture appointment because it's been a couple months since I've seen her. And now I'm thinking, like, I know, I mean, I literally share basically everything about my life. So this might be TMI for people, but I don't really care. I struggle with like hemorrhoids. And so I'm just like thinking about how I'm struggling right now more than I was when I was seeing her because she prescribed this thing to me and I only buy it when I go see her and I haven't seen her. So I haven't had those supplement or herbal pills
Yeah.
in a couple months. And I'm like, maybe I'm just like thinking, I think I need to get more of that from her because that's probably what's happening. And
Probably.
meanwhile,
Yeah.
I've tried everything, before that to kind of help with that. And nothing really worked.
Yeah.
So I think I need to get on that. Yeah. Thank you for
Yeah.
reminding me.
You're welcome. Hemorrhoids on this podcast. I need to get a refill.
I know, exactly. I guess that no one saw that one coming.
No, that's
Okay.
okay.
I know. I thought she was about to say like your IBS or something. Nope, hemorrhoids.
Well, no, but that's all like connected to it. It's like all
No, it
connected to it.
is. It
Because
is.
it is literally all connected. And that's another thing. She prescribed, that's one thing I was going to tell you when you mentioned that. What was the name of it again? You just said of that herb?
加味小药散, the chief herb in it is white peony root. It's known as, the Chinese name is baishao.
Baishao. Okay.
Yeah, baishao.
She gave me something. I'm going to go get it really quick.
Okay.
Hold on.
Okay, while Allison's getting that,
Yeah.
what's so funny is I play pickleball
Yeah.
and I play with this lady a lot and she's so sweet. I love her to death. We will be out. I live in Texas. We will be out in the Texas heat in the summer and she is drinking her warm tea and like one time it spilt and there's like these leaves in it and I'm like, and you can just like tell like it's warm too and I'm like, are you well? And she's like, I don't do cold liquids. I just don't. And I'm like,
And she's smart.
I know she is smart. She educated me on it, just like how you're like cooling the body, or you're like she was talking about the balance in the body, how when you drink cool fluid like ice water, whatever. I don't know.
Yeah. Well,
it's really cool,
there's a lot of like Chinese athletes. They drink warm or hot water when they're exercising, and it makes a lot of sense. I try to give some sense to people. Like if you're not going to commit to the hot water bit, as at least like room temp, like no ice, like no, like don't get too fancy. No textured water while you're working out. or just in everyday life. That's like a big lifestyle habit that people in China, they mostly drink like room temp or hot water. When they don't
Yeah.
feel good, they drink hot water. When they're going through a breakup, hot water. When they're anxious, hot water. When they're working
Yeah,
out,
no,
hot water.
she literally changed me on that. I
Yeah.
stopped at I like if I go to a restaurant, I say
Hmm.
just no ice and I
Yeah.
only drink room temperature. I haven't gotten to hot
Good
water
for
in the summer. I
you.
mean, that just seems like listen, I get lightheaded and stuff like
Well, here,
maybe I'll get there,
let me
but
challenge you this. Okay, so like I always tell like young women, especially those who have like really bad menstrual cramps, like around the time of your period, like no ice, no bare feet, no raw salads. Like we as women in Chinese medicine are yin, like yin in nature,
Mhm.
meaning like we're cold and cool and we're nourishing. So why would you introduce more cold in your body? Your body
Yeah.
doesn't like that. It's seeking warmth. If you think about the yin yang symbol, the white part is yang, meaning like sunshine, warmth, bright, youth, energy, right? But then you look at the black side with the little dot, right? Like that is women, so we're cool, we're whatever nature. And when you look at the yin yang symbol as a whole, what you're trying to achieve every day is this balance. So that's why she probably subscribed to hot water, is because if you drink hot water, it's harmful to your gut.
Yeah.
It
No,
makes your
she's
gut
so
have to
interesting
work
to me.
so much harder to keep up a body
She
that's warm.
she wears like tight outfits and like she has a curvy like she has a fit physique and she
Hmm.
wears tight clothes and I swear to you guys she's never been bloated like and so I asked her I was like you're never bloated like we will
Hmm.
go eat or whatever and I'm like have you ever been bloated and she's like no I'm never bloated.
She's like, "What's bloat?
Yeah, literally.
I
No,
don't have
she
that
like
problem."
literally asked me that. Like I'm like you're never like you never have a little bit like it never her stomach it never even like
No.
it is just she's a board in the front.
Yeah.
It's crazy.
Her stomach
That's
is the furnace.
Yeah.
that sounds
Yeah.
is that similar to like an Ayurvedic, like Ayurveda, you know what that is?
I think
I'm learning
In
about that.
Ayurvedic medicine, they have that concept. I'm not too familiar with it,
Okay.
but there's a lot of parallels. So,
Yeah.
hmm.
Okay, well I have my medicine that I found. Though I didn't find the one that I was taking all the time,
Yeah.
but I think this is what I actually found this and I think this is what she gave me for the which I thought I ran out of for the
Yeah.
hemorrhoids.
Uh-huh. Uh-huh.
I don't know if that looks
Yeah.
like similar for you.
Mm-hmm.
And
Mm-hmm.
then this I think she gave me because it says Serene Spirit. This one says Fargulin and then this one says Serene Spirit tea pills,
Serene
which
spirit.
it sounds like might be for stress. I don't know.
Yeah, yeah.
Sunflower?
Serene
甘美大早晚. Yeah, it's also good for sleep,
and sleep, maybe, yeah.
settling.
And then I think that is maybe what she gave me
Yeah.
for the hemorrhoids. But
That one I'm not
um,
familiar with, but definitely the second one.
okay, then I have to.
There's dazao, which is Chinese red date. That's a good one. That's a good ingredient to help you if you take it consistently and not too much of it because it can be very heaty, like very inflammatory if you do too much of anything, really.
Right. And
Um, but
okay.
it's probably a very nourishing formula for your body.
Well, and it's so interesting because I really rely on my acupuncturist
Hmm.
to educate me. Like if I have questions, she's so great. If I have questions, I can text her and she'll
Yeah,
say, "Okay, tell me about, what do
yeah,
you need?" Which is so great because well, there's some things I can't read on here because it's not in the English language, which
right.
I actually love because it means it's actually like
Yeah.
natural.
Yes, yes.
I'm getting it from the source and that's what I
Right,
want. But yeah, I think it's just hard sometimes when there's, you're learning so much about things, right? Everyone's
right.
listening and there's so much to learn. And, whether it's different supplements or these types of herbal, medicine
Yeah.
you can take, it just seems like a lot sometimes. So I feel like knowledge is power. I said that, I think, earlier today or yesterday on like Instagram. And I think the more you can just educate yourself is amazing and talk to experts like yourself to really get the information that I think isn't just trying to be salesy, isn't trying to
Right,
just say this is what's best and this is what's best.
right.
Like you're someone who is really encouraging people to know their best self and you're not pretending to know more than them. You know what I
Yeah.
mean? You just want them to find their best self. And I
Oh
love
yeah.
that.
Absolutely. I
Yeah.
mean, like, I think people are so tied to their Western diagnosis too, and it gets exhausting after a while. I know a lot of people who come to me have been thrown around in this healthcare system that hasn't really helped them. It's been a lot of like symptom management. So when they start exploring um, like a medicine like Chinese medicine, they're like, what's a pattern? What does that mean? Like I think about like migraines, right? Or oh no, let's do anxiety. Anxiety is pretty straightforward. Like everyone can come in with anxiety, but this person can be, a spleen deficiency pattern with anxiety, meaning like they have gut issues alongside with their anxiety. But this other person is just straight anxiety, full of anger, full of irritability, and nothing necessarily wrong with their gut. Although I rarely find it in isolation. Another person could be anxiety and like perimenopausal or menopausal. And that's just a natural course of life. That's not even anything maybe necessarily stressful, like in terms of like trying to get pregnant or anything. It's just a natural part of being a woman. And then in that case, I'm not necessarily looking to just calm down their liver in Chinese medicine, which is like the emotions for anger and frustration. It's like, how do I nourish their body? Because now they're losing fluids. So that formula you have is a good one to help retain fluids, help nourish your bodies, and settle the mind.
Oh, awesome.
Yeah, that's what I've noticed.
Okay. Yay.
hmm
Well, this has been so knowledgeable and amazing. I feel like I could talk to you for
I was
another
just thinking that.
5 hours. I mean,
I'm like,
honestly,
oh my gosh, we don't usually talk to guests for an hour. We usually they're like
yeah,
30 to 45 minutes, and I still have a lot
Oh,
of
thank you.
questions.
I'm having
yeah.
fun.
So, yeah, well, we'd love to have you back on at some point just
I'd
to
love to
dive
come
deeper
back.
into Chinese medicine for
Sure.
sure. And I will talk to you offline for sure about connecting with you because I'm going to be in Greenwich in
Great.
like 3 weeks or so. So I'd love to
Awesome.
meet up for coffee or something.
Absolutely.
Um, and so tell everyone where they can reach you and if they can contact you or how to get in touch with you.
Yeah, absolutely. I am most active for socials on Instagram and occasionally TikTok. The username is anew.acu, anew.acu. I'm also on YouTube, Anew Acu without the period. But that's the best way to get in touch with me. You could also go to my website, www.anewintegrative.com, if you're local and would like to see how I can help you. But other than that, I'm usually accessible via socials. And then the really cool thing is that if your followers grab my guide, they'll automatically get these weekly newsletters on just little tidbits like how to help yourself, how like what did they learn from the guide. So I'm really excited to share with you guys.
Yay, I love that. And I almost forgot about the at the end of the episode. Um, we ask our guests that are on, but I usually do this when we don't have a guest. If
Sure.
you could if you could share with our audience just one healing tip for this week that you would recommend, like a healing tip of the week. Is there something that you would recommend for this topic for our listeners and our watchers?
Ooh, yeah. Taylor, it goes back to the hot water. Honestly, it's seriously life-changing. It's almost like a joke sometimes to like between my mom and I, like, oh, you're sad. Hot water, like hot water kind of fixes a lot of things. Now, if you cannot wrap your mind around the hot water, you could dress it up like caffeine-free tea. You can add some like flowers to it. Hot water helps your body settle by sweating a little bit, getting the blood flowing, and just giving you a totally different type of energy. And also, more importantly, it helps your digestive system. So that is my tip of the week. Try it for a week, and then reassess and see how you feel.
I love that. And let me just tell you how much that helped me when I was getting off of caffeine. And now
Yeah.
I only drink herbal teas. I don't drink any caffeine.
Oh,
Of course, there's
amazing.
other natural ways for energy and stuff if
Sure.
people want to try that. But for me, it was basically hot water with lemon. I would put some honey in it sometimes, but hot water with lemon. And then I would obviously drink like herbal teas too on top
Good
of
for
that.
you. Yeah, I mean, if
Yeah.
we can get onto that culture of like the hot water culture, I mean, like it can be life changing. And if you're feeling run down, like sick, hot water. It's
Yes.
Go
the
make
vibe.
go make some hot water, Allison.
I already had my tea this morning, but I plan on doing it again in about an hour when I start
Exactly.
up with clients. All right. Well, thank you so much. I appreciate you. I will be in touch for sure. Everybody, thanks for watching and listening. We'll be back next Wednesday, or actually, they drop on Saturdays. Well, we record on Wednesdays, but we'll see you on Saturdays. Thank you so much again. We'll talk to you guys soon. Bye.
Bye.
Bye.